doing great. Welcome to my channel. My name is Damia and I'm here to tell you today about important things about extracting your teeth during the extraction and after the extraction. So we have some common things that might happen during the extraction, and very common. It happens with a lot of people. Very normal, very common, and there are some less common where it may not happen. So during the extraction and after the extraction, common things are infection, infected tooth after the extraction, which is very normal. Could be infected because of your touching the area where like your hands are not clean, food gets stuck in there. That's very normal. It happens with a lot of people. Swelling also, swelling might occur after. That's also normal. It might get infected, swollen face. That's normal. That's fine. But you just gotta follow the instruction, and then you'll be just fine. So let's get to that. Like also as well as dry socket. Dry socket is like to extract the tooth after, like the few days after. If you're not following the instructions, then you might get an infected area, and it might get swollen. You might have a dry socket, and I will come to you after with all that. So I'm gonna tell you about it after. We're gonna go step by step. So it might bleed for several days. Like it might bleed the same second, like starts the same second that we extract the tooth, and after that it continues. Like it might continue to a few days. You might miss a few days of work, same first day as well. That's normal, that's common. A lot of people come after that and they have severe pain, let's say, and that's from the dry socket or from the infection. That could be normal and common actually. So as well as other things that the pain may like we give you anesthesia, and so you might be numb for a while, like for 2-3 hours after the extraction. But after you leave from there, I'm gonna come to you with what you're gonna be taking after. So but the pain might last it might last 2-3 weeks. Like it might come and goes. It might, you might take Tylenol and Advil for that, and that would be a common thing as well. You might have very stiff jaw, like we're gonna keep kind of have a lot of pressure to take the tooth out. So that would be normal as well. So from opening the mouth, from a lot of pressure that we keep on the tooth to take it out, which you will feel, even though there's we give the anesthesia, you're numb, but you will still feel the pressure. You may not feel the pain, and you let us know if you do, but the pressure you will feel for sure. That's also common. Let's say there sometimes in some cases some teeth might be very weak. So while we're extracting, like we're pressing on them and we're giving a lot of pressure, they might break. They might it might happen. So we also have while we're trying to take the tooth out, it might break other teeth. That's not common, but that might happen. It might happen in a lot of cases. So let's go to the next one, which is less common. The less common ones, they don't really happen, but it might happen. So we usually give you the list of the common and the less common before we have you sign the consent form. So what we do sometimes, when we do the injection, I might hit the nerve of the area, like of the jaw here, or anywhere, like especially here, the bottom teeth. So you might, if we do hit the nerve, then you might have numbness for let's say 6 months. It might go away, but it might sometimes it stays for good. So you should be aware of that. As well as if the tooth is on the upper side, from both sides, anywhere upper, it might be close to the sinus. If we take it out, it might have a hole in there, and every time you drink something, or if you drink something, you might come out of your nose. We're not trying to scare you. It's just something might happen, but it's less common. So it could happen like 1 in 1,000, or even not even, like maybe 2,000, like 2,000. That's normal. So sometimes if the tooth breaks, if it's very, very weak and it gets like it breaks inside the socket, inside the bone there. We try to take it out. We try our best to take it out, but if it's too deep, we won't really dig in to take it out. Like it might, we might keep it, or we might send you to an oral surgeon, which will be under your cost. Like it might cost a lot more than the normal dentist will charge. So that one you should know about, as well as it might like while we keep like a lot of pressure on this tooth to take it out, so it might break other teeth. Like they're very close to each other, right? So it might break. They might get damaged. If you have crowns, if you have bridges, they might get damaged as well. But that's very, very less common. Let's see, what else do we need to say? Okay, so if anything happens to you during that, like you should be like we will let you know, and we will tell you about that. And or if we send you to an oral surgeon, it will be like as I said, under your cost. Let's move on to the after the extraction. We take the tooth out. It's out already. So what we do next is we put gauze on the place where the missing tooth is, and you keep that, and you keep a good pressure on it for at least an hour. You keep pressing on it for, like, you bite on it for a really good thing. Like you stop maybe not talking for 10 minutes. So after that, after the 10 minutes you can speak, okay, but you need to press really good on it. Like keep firm pressure on it for an hour. After the 1 hour you check it. If it's still bleeding more than one drop here and there, you keep another gauze. We usually give extra to the patient, so they take it home with them, and if they want to change it, you wash your hands really well with soap, at least twice or something, and then make sure they're clean. And then you take two gauzes, you wet the middle part of them, and then fold them, and then put them on the place. You place it there for another half an hour. For a lot of patients ask us about what to do, like will they be able to eat. So any hot beverages for the first 2-3 hours, we don't really recommend that, because you might burn your tissue and you don't know because you're frozen. So we recommend that you drink hot beverages after the 3 hours. And if you want to drink anything, so like the first important thing, the first 24 hours, will be no spittings, no rinsing, and no drinking through a straw. So that's very important. Like no drinking through a straw, anything with sucking on, like a straw, spitting out. A lot of patients do that. Like they come out of the chair, they right away try to spit out, which is very normal, common for a lot of people. But the thing is, you don't want to do that, because every time you spit out, you take out the blood clot that is covering the bone under where the missing tooth is, and then you'll have a dry socket, which a lot of people ask about the dry socket. The dry socket is when we take the tooth out, it's empty spot here, that's the bone, and then we want this bone to form and go back together, and sorry, not the bone, the tissue, the gums. So what we do, like we try to, that's why we keep the gauze on, and sometimes we have to stitch the place. So when we stitch it, then some of the sutures are removable, some of them are not, most of them are not. So don't worry about that, don't play with them. Don't try to take them out, don't try to play with your fingers, with your tongue. A lot of patients do that and they get infected area like after, so which you don't want to do that, so you avoid doing that. It might come off in 5-7 days, something like that by itself, you won't even know. So that's okay, that's normal. You might have pain after that. You take Tylenol, Advil after, and don't take too many of them. If the pain continues, like we usually book the patients in 3 days after the extraction. So if they have like swelling, if they can't sleep at night, they're in a lot of pain, no Tylenol or Advil is working, we book them for that appointment and they come for this appointment. If they're having all that. If not, then they can cancel same day. That's okay, that's fine. Also, food, soft food is okay to eat on the other side of their mouth. Like, you don't have to eat on the same place. We don't want any food to get stuck in there, so eat on the other side. Soft food, soft food, yeah, it's good. And brushing, keep the area very clean. Keep it all clean, like brush everywhere, but don't spit out for the first 24 hours. Just open your mouth and let the water come, like the saliva or whatever comes out. And also another thing, that if as soon as you leave from the clinic, or even before, like after we place the gauze in there, it's okay to swallow your saliva. It's okay, it's fine. All the blood will be on the gauze, so no problem, don't worry about that. Don't keep spitting out. That's what I'm trying to say, like avoid spitting out. Try to open your mouth, and if it gets swollen, just keep cold pack on, 20 seconds on, 20 seconds off for the first 24 hours. After the 24 hours, it's okay if you use warm, that's fine. After the 24 hours, you rinse with warm salt water. Rinsing with warm salt water is okay after the 24 hours, not before the 24 hours. After the 24 hours, it's very important to rinse with warm salt water to clean the area, kill the bacteria in there, and keep it clean. Like, keep brushing, don't forget to floss and brush. It's okay, it's not gonna be a problem for the other tooth, the missing tooth, that's fine. Just keep brushing, floss first and then brush, and then open your mouth for the first 24 hours to let the water out, that's fine. Rinsing with warm salt water after the 24 hours is very important. So just do that every 4 to 6 hours until, like, maybe take a day or some, like, or so. Just do that. Keep doing that after the 24 hours are done. Smoking, no smoking, no smoking, no smoking. Keep it healthy, clean, healthy. Drink a lot of water. To avoid smoking, number one, like, smoking is a really big issue, really big problem. Like, if you smoke within, let's say, 3 days, like minimum of 3 days, if not 1 week, avoid smoking for 1 week. That's a good opportunity for you to quit smoking. Awesome, that would be great actually. But if you have to, then like at least 3 days no smoking, at least within 72 hours no smoking, nothing to suck on. Like, that socket has to be covered with the blood clot and the tissue, the gums. So that's what we want. 24 hours, no exercising, no heavy lifting. I know there are a lot of mothers that come and they have to carry their babies, but try to carry them, but in a like gentle thing, like, you know, don't keep carrying them all day like usual or like always, just because of this time you don't want to have a lot of bleeding, and we're trying to avoid that. So try to use something else for that. People with infection, we might give antibiotics, so finish that all. If we tell you to finish it all, finish it all. Sometimes you don't have infection, but so we just give you Advil, ibuprofen, so take that only if needed, if you have a lot of pain, and that's about it. So wish everybody a healthy teeth, so they don't have to go through extraction and all that. Thank you for watching.